shows all patients who received the second dose had no complications. Dr. Reena Mehta of Uptown Allergy and Asthma joins us now to explain. So, Doctor, we had a little bit of time to chat about this just before we got on TV here. Before we talk about what that study shows about people getting that second vaccine, what kind of allergic reactions are being reported with some people because of that first vaccine dose?
Okay, so that's a great question. And so, I mean, when we think about allergic reactions, it's a spectrum. There can be a variety of reactions that you could have. The most severe type of allergic reaction is something called anaphylaxis, where it could be a potentially life-threatening reaction where you could get, throat closing, shortness of breath, lip swelling, tongue swelling, hives. And that's been reported in about 2% of patients who have received one of the two mRNA vaccines. So, I mean, it's a pretty low risk number. And then there are other patients who might have, more low intensity reactions, such as maybe just some hives or something like that.
But this new study that you've all been reviewing shows that, okay, you had a severe or a minor allergic reaction with shot 1, but you should still get shot 2. And what they're finding is not reactions again on that second shot. Is that what's been found?
Exactly. So prior to this study being published, basically the recommendations were, okay, if you had an allergic reaction to the first dose, either you're done and you just hope that, those antibodies after dose 1 would be enough to carry you through, or maybe you can get another vaccine with like Johnson & Johnson. So, you wouldn't be able to finish your original vaccination series, but maybe you could get, that J&J booster. And so this recent study was published in JAMA Internal Medicine, where it was a multi-hospital study. So they looked at allergy patients across the country at different institutions, and they had about 159 patients who had allergic reactions to the first dose, and all of them were successfully able to receive the second dose. And so what they found was that 20% of those patients who got the second dose did have some symptoms, but they were mild. They were able to work through them, usually with antihistamines. And 30% of them actually pre-treated with antihistamines before the second dose, and that was enough to get them through so that they could complete their vaccination series.
And Dr. Mehta, I know a lot of people out there have severe allergies. They have minor allergies to all kinds of medicines, to shots, the list goes on and on and on. If you are a person, if someone's out there watching and they have been holding off on getting any of their vaccines because of allergies they have to other stuff they've gotten in the past, obviously with the Delta variant going around, you would highly encourage them to get the vaccine, but also have a serious conversation with their doctor about how to proceed, be it having those antihistamines prior to the shot or during or what have you. Is that what you would recommend?
Absolutely. And so, having just, food allergies or environmental allergies, that doesn't put you at increased risk for having an allergic reaction to the COVID vaccine. So that's kind of the important thing to note, is one doesn't equal the other. They are two totally different things. But if you have a lot of allergies or you've experienced an allergic reaction to the first dose, that doesn't mean that you stop there. You should seek consultation with an allergist, because an allergist will go through your history and stratify the severity of a risk for a reaction to the second dose, and often can even do allergy testing to the ingredients in the COVID vaccines to see whether you're truly allergic or not, and give you a plan on how to receive the second dose safely.
So the key through all of this, whether you have allergies or not, and when it comes to this vaccine, is talk to your doctor about your specific case, because every person is different. So there's no one size fits all approach, and don't go to the internet to figure this out, correct?
Exactly. Don't just assume that you can't get the second dose because something that certainly, if you want to complete the vaccination series, which hopefully you do, talk to your doctor about it, because there are ways to successfully do it without having a reaction to the second dose.
But talk to your doctor, that's key. All right, Dr. Mehta, as always, we appreciate your time.